Before we get started, please keep your lines muted to prevent any background noise during the session. And also, we will have time for Q&A towards the end of the session. However, if you have a question that you don't want to forget, please put it in the chat, as we will be monitoring the chat window for the duration of the session. So without further ado, let's get started. Next slide, please. The mission of our organization is to advocate on behalf of Black women and girls to promote leadership development and gender equity in the areas of health, education, and economic empowerment. Our vision is for Black women and girls to live in a world where socioeconomic inequity does not exist. We believe in gender equity, inclusion, respect, racial and social injustice, integrity and accountability, economic empowerment, and collaboration. In this evening's webinar, we will focus on health, where our priorities are to raise awareness of health disparities and solutions and provide access to healthcare and wellness information that promotes behavior change, resulting in a healthier lifestyle for our young people and communities. Again, we are thrilled to have you here with us this evening. And at this time, I'm going to pass it over to Sister April Day for the official welcome and agenda walkthrough.
Thank you, Sister Latoya. Good evening, Madam President, board members, sisters, and guests. We are your six sisters of solidarity, and it is indeed an honor and a pleasure to welcome you all to our discussion on dispelling the myths about fibroids, their effect on Black women, and the importance of self-advocacy. Our speaker for this evening is the amazing and very knowledgeable board-certified Dr. Sharon Aldridge. Please feel free to ask questions and/or tell us how this condition has impacted you or someone you know. It is our goal that you are able to take away some very beneficial information from this topic as you gain more knowledge, because we are our sister's keeper, mind, body, and soul. Next, I will give the flow of our agenda. We will have an opening activity by Sister Pamela Davis, followed by introduction of guest speaker by Sister Jamaica Young. Then after Sister Jamaica Young, we will hear our amazing guest speaker, Dr. Sharon Aldridge. That would then be followed by a Q&A session by our Sister Tierica Lewis. And the event evaluation and drawing will be done by Sister Monique Hamler. And we will have closing remarks by our amazing Madam President, Valerie Bird.
Thank you, Sister April. So next we will pass it on to Sister Pamela Davis to facilitate our opening activity. All right, Sister Pam, are you on mute?
I am now.
Okay, we can hear you.
Okay. All right. Good evening, everyone. My name is Pam Davis, as Sister Latoya said, and I have been charged with facilitating the opening activity. It is, what do you know about fibroids? So here are the instructions. There will be 5 true or false questions for you to answer. We want you to drop your response in the chat, and those participating in this activity will be entered into a drawing to win a prize. How does that sound? All right, so let's get started with our first question. And I want you to know that you have 10 seconds to put your answer in the chat, and then we will let you know what the answers are to each question. So the first question, fibroids always cause symptoms. Fibroids always cause symptoms. So let us know what you think in the chat. All right. Okay, great responses. Okay, we're ready for the next slide. All right, the answer to that is false. Most fibroids do not cause any symptoms, but some women with fibroids can have them. So thank you guys for your responses. Okay, let's move to the next question. True or false? Fibroid tumors are cancerous. Remember, you have 10 seconds to drop your answers in the chat. Oh, you guys are quick. Okay, next slide. That is false. Fibroids are almost always benign, not cancerous, and rarely less than 1 in 1,000 will have a cancerous fibroid occur. All right. Next slide. True or false? Fibroids lead to infertility. True or false? Fibroids lead to infertility. Wow. Some mixed answers there. All right. All right. I think we are ready for the next slide. That's false. While fibroids can impact fertility in some cases, not all women with fibroids struggle with conception. So I'm sure our speaker will share a lot of information in that regards. All right, next slide. All right, question number 4. This is probably the hottest topic when we hear about fibroids. Surgery is the only option available to treat uterine fibroids. Wow. Okay, let's see. Let's see what the answer is. That's false. Surgeries such as hysterectomy or myomectomy are treatment options, particularly in severe cases. However, there are non-surgical options depending on the size and location of the fibroid. Last, but certainly not least, is question number 5. 2 risk factors that can make someone more likely to get fibroids are race and family history. Y'all are quick. Let's see. Okay, I think we're ready for the next slide. That is true. Race, family history, along with other factors such as obesity, diet, and lifestyle choices are all factors that can contribute to a woman developing fibroids. All right, so that concludes our opening activity. Thank you to everyone that participated. Remember, your name will be placed in a drawing for a prize that will be announced at the end of the webinar. Now I will turn it back over to Sister Latoya.
All right, thank you, Sister Pam, for walking us through that opening activity to help establish just some foundational knowledge before Dr. Aldrich begins. So with that said, I am going to now hand it over to Sister Jamika Young to introduce our guest speaker for this evening. All right, Sister Jamika, you may be muted. Sister Jamika, I think you're muted. You're speaking.
Her audio is reconnecting.
Okay.
She might be having some technical difficulties.
Is someone else able to pick up and do the introduction for Dr. Aldridge?
Yeah, Sister Pam, do you would you have it available? Let's see if we can give her a second.
I'm ready.
Okay, thank you,
Dr.
Sister.
Yes.
Mhm.
Dr. Sharon Aldridge, MD, is a highly experienced and board certified obstetrician and gynecologist dedicated to providing exceptional patient-centered care with a career spanning over 2 decades. Dr. Aldridge has established herself as a compassionate and skilled physician, committed to improving women's health through comprehensive medical care. She earned her medical degree from the State University of New York in Brooklyn in 1993 after completing her undergraduate studies at New York University in 1988. She went on to complete her residency at Brookdale University Hospital in Brooklyn, New York, where she also served as chief residence. In this role, she was responsible for teaching and supervising residents, honing her skills as both a clinician and educator. Dr. Aldridge holds medical licensure in South Carolina, where she has practiced since 2004 and was previously licensed in New York. She is board certified by the American Board of Obstetrics and Gynecology and is an active member of several professional organizations, including the American College of Obstetrics, I'm sorry, y'all, and Gynecology and the South Carolina Medical Association. Throughout her career, Dr. Aldridge has been recognized for her dedication to her patients and her profession. Her affiliation with Palmetto Health allows her to continue her mission of delivering excellent care to women in her community. Outside of her professional life, Dr. Aldridge is deeply involved in her community. She is married and has a daughter who is currently a junior at the University of South Carolina. She is an associate member of the Jack and Jill chapter in Columbia, South Carolina, an active member of the Upsilon Omega Omega chapter of Alpha Kappa Alpha Sorority Incorporated, and currently serves as the vice president for the Columbia chapter of the Links Incorporated. When not practicing medicine, Dr. Aldridge enjoys volunteering, mentoring young physicians, and staying engaged with the latest advancements in women's health. Without further ado, I present to you Dr. Sharon Aldridge.
Good evening, ladies. It's a pleasure to be here. And I'm actually, Pam's question answered a lot of what I was going to say. Y'all don't really need me, but we'll go over the slides anyway. First slide, please. Uterine fibroids in African American women. This is going to be a comprehensive overview so we can understand the prevalence, the symptoms, and the treatment. Next slide. Fibroids are a common non-cancerous growth of the uterus. It's particularly prevalent and impactful in the African American community. Next slide. There's a high incidence of fibroids. Up to 80% of African American women have fibroids, but are diagnosed with fibroids by the age of 50. We typically have an earlier onset, presenting in 20s and 30s. The fibroids tend to be larger and grow faster in African American women. Next slide. There are some genetic factors. There's a strong hereditary link for fibroids. There's some hormonal factors. African American women tend to have higher or elevated levels of estrogen and progesterone, which contribute to fibroids. And there's some environmental factors, exposure to environmental estrogens. And there have been some studies that actually show that there are environmental estrogens in some of our hair care products that has increased the risk of African American women developing fibroids. Next slide. Lifestyle factors, diets high in red meat, low fruit, low vegetables, also being overweight, and chronic stress also increases the risk of having fibroids. Next slide, please. Okay, fibroids are classified based on where they're located in the uterus, and the symptoms actually depend on where they're located or whether you even have symptoms. Commonly, they present with heavy menstrual cycles. Either the cycle is heavier during the 7-day period. A normal period should come between 19 and 35 days. Any cycle that is shorter than 19 days, meaning you get in your period every 14 days, is considered to be abnormal. And you should bleed between 3 and 8 days. If you're bleeding 10, 11, 12, 13 days, that's too long. You can have heavy bleeding during the time, or you can have extended bleeding, or you can have intramenstrual bleeding, which means you bleed and then your period stops and you start again. All of these things can lead to anemia as a result of fibroids. Fibroids can also cause pelvic pressure and pain. Depending on where they're located, they can make sexual intercourse uncomfortable. They can cause difficulties with urinating, difficulties in being able to empty the bladder, and also difficulties in holding your urine, depending on where it's located. It can cause constipation. It can cause pelvic pressure. It can cause reproductive issues. It can cause difficulties in getting pregnant, depending on where they're located. It can cause increased risk of miscarriage. It can cause increased risk of preterm labor. It can cause increased risk of what we call fetal malposition. Because of where the fibroid is, the baby can't switch to have head down, which increases your risk for having a cesarean section. And as a result of this, it can have an impact on your mental health, which can lead to anxiety and depression. Next slide. Next slide, okay. How is it diagnosed? The number one way fibroids are actually diagnosed is with a clinical exam. When we go to our exam and we get a full exam, you get a pap smear, and then the second thing the doctor's supposed to do is something called a bimanual exam, where they stick one hand inside your vagina and one hand on your uterus. That's assessing the size of your uterus. Normal uterus, we always compare things to fruits in GYN. I don't know why, but a normal uterus is about the size of a pear. So when the doctor examines you, and if their hand is up at your belly button, that's abnormal, because your uterus should be below your belly button if it's the size of a pear. The second thing we use for diagnosis is an ultrasound. And those two things can make the diagnosis 95% of the time. Sometimes if somebody is extremely overweight and the ultrasound pictures are not good, we can do an MRI. And other times we can use what we call a hysteroscope or a laparoscope, which are surgical procedures. Usually those procedures are being done for something else, and then we incidentally find fibroids. Next slide. Okay, so I'm going to go over some of the treatment options. I'm going to start from the most benign treatment option, and then speak about surgeries and the different surgical options. Hormonal therapy, and again, some of the treatment options depend on what your symptoms are and whether you want to preserve fertility or not. So hormonal therapy is something like birth control. Don't affect the fibroids in any way, but they can regulate the bleeding. So birth control pill, IUD, many of those things are recommended for somebody who's young with fibroids, who wants to have a baby in a year or two, and the fibroids are not so big, so they're just controlling the symptoms. Same thing with something, it's called TXA, which can decrease the amount of bleeding, and NSAIDs like Motrin or Anaprox can be used for bleeding and pain. Next slide. This is the next level. So these are invasive procedures, but they're not done in a surgical setting. Uterine artery embolization is when they inject material and that cuts off the blood supply to the fibroids, and it can cause the fibroids to shrink. This is actually not done by a gynecologist. This is done by a radiologist. This is the temporary aspect because the body has a strong regenerative factor. So you can use it. It works best if you got 1 or 2 big fibroids. You can cut off the blood supply and it'll cause the fibroids to shrink, but fibroids will regenerate. And also, it's the same thing for the ultrasound surgery, where they use a needle and they stick a radio frequency into the fibroids, which kills the fibroid tissue non-invasively and causes them to shrink. But any uterus that has fibroids has big ones that you can see, and many times they have a lot of small ones. So those are not affected by that, and they tend to grow. So if you have a procedure like this very young, it is not uncommon in 2 or 3 years that you're going to need something else to be done. Next slide. Endometrial ablation and accessor are the next level of treatment. And again, it really depends on where your fibroid is and what your symptom is. The endometrial ablation burns the inside lining of your uterus so that you don't have heavy menstrual cycles if that's your main symptom. And if there are fibroids inside the lining of the uterus, they can be removed at that procedure. The accessor is the same type of procedure as the MRI one that we talked about, but that's done with a laparoscope, where laparoscope, which is a little telescope that's stuck in your belly button, fibroids are identified, needle is stuck into them, and they're radio ablated to decrease or kill the fibroid tissue so that the fibroids shrink. Next slide. These are the two main surgeries that are used to treat the fibroids, and the reason why one would choose one over the other is whether you need to maintain fertility or not. So a myomectomy, in short, removes the fibroids, preserves the uterus. A hysterectomy takes the fibroids out. How I describe it to my patients when I have a conversation about it is I describe the uterus as a potato. And we've all had a potato that we left in the pantry too long that has a bunch of eyes in it. If you need that potato because you're making potato salad and you don't have enough, you're going to cut all those eyes out, you're going to clean that potato, and you're going to cut it and use it. But if you cut those eyes out of that potato and put that potato back in the pantry, it's going to go bad again. It's the same theory with the myomectomy. If I do a myomectomy on somebody because they're planning on having kids in a year or two and they don't get pregnant, 3 or 4 years later, those fibroids are going to grow back and they're going to have the same issue again. Hysterectomy can be a total where they take out the uterus and the cervix, or partial where they just take out the uterus. When we do a hysterectomy, unless there's something wrong or the person is very old, we don't normally take out the ovaries. And the ovaries are what cause you to go through menopause, what cause you to have hot flashes, and ovaries are generally preserved when you do a hysterectomy. How we do the myomectomy versus the hysterectomy really depends on the size of the uterus. There are a lot of discussions about doing surgeries laparoscopically or doing it with a robot where they're less invasive and you're only in the hospital overnight or you don't have to stay in the hospital. All of that is dependent on the size of the fibroid. If the fibroid is the size of a grapefruit or watermelon, I can't take that out of your belly button. It has to be an open surgery. And one of the issues or common findings is when African Americans present, they present late and they present with larger uteruses. So doing some of the minor surgeries or the less invasive stuff becomes a little bit more difficult because of the size of the uterus. Next slide. Lifestyle changes. Diet, high fruits, high vegetables, low red meat, even chicken and white meat, which is good for you. A lot of these foods have hormones in them, which when you ingest a chicken that has had estrogen and hormones in it to make it big, you're ingesting that estrogen also, which is affecting your body. So honestly, high fruits and vegetables are better when you're thinking about, I have fibroids, I want to do something better with my diet. Maintaining healthy weight. Fat cells store estrogen. So the more overweight you are, the excess estrogen you have, the increased risk that you are for developing fibroids or having your fibroids grow fast. Reduction of stress. Techniques like yoga and meditation are very, very helpful for stuff like that. Next slide. Cultural and social considerations. As we know, there's an access to care. There's a barrier, which lack of insurance, lack of ability to get to see a specialist, which also contributes to why African Americans present with very large uteruses. They tend to come to the hospital and we are anemic to the point that we need blood transfusions. So in many situations, they come at a time where a lot of the options are, the minor options are taken off the table. And that is one of the reasons why there's such a health disparity. And in many situations, people are directed towards a hysterectomy when they don't necessarily need to be. Awareness, advocacy, knowing the different options, discussing the different options with your physician. To me, the most important thing in healthcare is having a physician that you know and trust, and you know that that person's going to do the best for you. Anybody who comes to see me and knows me, I encourage you to Google. I encourage you to look up everything so that we can sit down and have a conversation about what you've heard, and I can explain why that may work, why that may not work, because that helps you get the right decision, procedure, care for yourself. Not every fibroid needs any type of management. If you have fibroids and you're not having any pain and you're not bleeding, nothing needs to be done except to follow them. Next slide. Stated before, regular gynecological exams. There's been a push. A lot of insurances do not cover pap smears yearly. You're supposed to get them every 2 to 3 years. If you haven't had any issues, you're still supposed to come see me. You're still supposed to have the bimanual exam, have conversations, discuss maybe any irregularities or changes in your menstrual cycle. And that's important because a lot of people think because they don't need a pap smear, they don't need to come. And that's not actually true. And as I stated before, education, proactive health management, looking up information, talking to people, and having a physician that you can talk to about your different options. Next slide. As stated before, there's some ongoing research about genetic and hormonal reasons for fibroids, environmental factors, changing some of the stuff that's been used in our hair care products. One of the things that we know is that African American girls tend to get their period about 1.5 to 2 years before white girls do. The longer you're bleeding, the longer you're exposed to hormones, the longer you have a chance of developing fibroids. So there's been some research in changing and cleaning up some of the stuff that's put in the hair care products that we use, and that grease that we used to get every Sunday when we got our hair straightened and mom did our hair for the rest of the week. Many of those have things in it that mimic estrogen in the body. And there's been more and more advancements in minimally invasive techniques also. Next slide. Summary, fibroids are a significant health concern in African American women. Early detection, awareness, access to treatment are critical, because the type of treatment that's available to you is really related to early detection and finding the fibroids when they're small as compared to later. Next slide. Questions?
Wow, thank you, Dr. Aldrich. That was amazing in terms of providing more insightful and valuable information. I know that I got a lot of nuggets about fibroids that I didn't know about. So we're going to pass it over now to Sister Tierka Lewis to facilitate Q&A. Sister Tierka, you may be on mute.
I am. Good evening, everyone. My name is Tierka Lewis, and at this time, we'd like to give our audience members the chance to pose any questions that you all may have for Dr. Aldrich regarding our topic tonight. We ask that you place any question that you may have in our chat, and we will present that question to Dr. Aldrich. Are there any questions? Okay. I think Dr. Aldridge, you've covered so much and given us an abundance of information. I don't see any questions in the chat as of now. Okay, so there is one question, and it reads, what happens to fibroids during pregnancy?
So during pregnancy, fibroids grow as the uterus grows. It can be a problem in terms of where the fibroid is, because like I said, it can increase your risk for having a miscarriage. It can increase your risk for going into labor early. The fibroid can actually outgrow its blood supply and cause severe pain during the pregnancy. It can cause you to go into preterm labor. And like I said, again, where it's located, it can cause the fetus not to be able to descend in the pelvis properly and increase your risk for C-section. And then when the uterus, it's time for the baby to come out and the uterus contracts, it prevents it from contracting the way it's supposed to. So it can cause postpartum hemorrhage as a result of that also. So anybody who has a fibroid uterus, we watch them very closely, watch the fibroid very closely. Depending on how big the fibroid is, your doctor may recommend you removing it before you try to get pregnant, which is another reason why you want to do preconceptual counseling. Fibroids are never removed during surgery because they're usually during pregnancy because they're usually 2 and 3 times the size it's supposed to be. Most of the time, if you have a successful pregnancy with the fibroid, we'll follow it, check it 4 months or so after the hormones have left your body and determine whether it needs to be removed or just watched.
Thank you so much. Our next question reads, although fibroids may not be cancerous, do they pose any other dangers? I know you mentioned factors such as anemia and, of course, miscarriage. Are there any other issues that we need to be concerned about tonight?
Anemia issues and pelvic pain. Those are the main things. Difficulty with being able to void completely, or even having incontinence because the fibroid's pressing on your bladder, so you can't really hold your urine when you need to. But those are really the main factors. Most of the people that present with fibroids either present with pain or anemia. And all that comes with that. So if you're anemic, you can have cardiac issues, you can feel lightheaded, you can feel dizzy as a result of all of that.
Thank you so much. There's another question in our chat, and it reads, do you know what the harmful ingredients are in the Black hair care product?
Tea tree oil is actually one of them.
Oh, wow.
Right, and we all put in tea tree oil everywhere, but tea tree oil is actually one of them. You know, this is an aside, all of you who have girl children, you know, we have to encourage our babies to do research. No white man is sitting there doing research to see what hair care products are affecting us. This is the stuff that we're going to have to do for ourselves. Wow. Because this is a topic that's important to us. Buy an organic if you can afford it. They're putting estrogen in the milk. Chickens are 10 times the size they used to be when I was a little kid, getting them out of my grandmother's backyard. All of this is hormones that we are ingesting that can affect us and our fertility later on.
Wow, that is so amazing. I never knew that. And we're using all of these natural hair care products. And tea tree oil is in all of them. So thank you for insight on that. Another question reads, will fibroids decrease during menopause?
They usually do, but that's not a blanket situation. It really depends on how big we start with from the beginning. You know what I'm saying? If you have a fibroid that's maybe the size of an almond or even a lemon, that's going to drop down. If you're going into menopause with a grapefruit or a watermelon, it's really not going to shrink down completely.
I think that's our last question. Oh, I'm sorry. Is there a list of hair care products that you would recommend?
I do not have the answer for that because I went down a rabbit hole with that at one point. I started making my own stuff. Um, and I'm not necessarily recommending that, but I do avoid tea tree oil.
Okay. Thank you so much for answering all of our questions in the chat. At this time, I'm going to turn it back over to Sister Latoya. Thank you so much, Dr. Aldrich, for that wealth of knowledge.
Absolutely. Thank you. And thank you, Sister Tierica. All right. So now we are going to pass it over to Sister Monique Hamler for our event evaluation and to do a fun drawing based on who participated in the questions earlier. So I know everyone likes to win fun prizes. So Sister Monique, turning it over to you. And Sister
Hello.
there
Yes.
you go. Okay.
Hello, everyone. We thank you all so much for joining us tonight. And thank you, Dr. Aldrich, for such valuable information, very resourceful. And we appreciate you. So with that being said, everyone, your feedback means a lot to us. Your feedback is very valuable. So we ask that you'll scan the QR code or click the link, which I will drop in the chat shortly. 1 second. Oh, sorry. And while I'm here, anyway, also follow us on social media. We're on Facebook, Instagram, Eventbrite, Carolina Panorama, and LinkedIn. And also feel free to visit our website. But I'm going to go back to the other screen so that you can scan the QR code. Yes. Alrighty. And I'll give you a second to do that. And then let me go over to the raffle, the fun part where everyone was waiting for. It is raffle time. So our 2 lucky winners for the evening is, if I could get a drum roll. Our 2 lucky winners are Sister Kiani and Dr. Stephanie. Congratulations on winning. You will win a Amazon e-gift card. So if you can write your email in the chat, you can send as a private message to me. And I will be able, and we will be able to send over Kiana, we will be able to send over your Amazon gift card. And I hope you all enjoy. And thank you all for participating. Your presence means a lot to us. And now we will turn it over to our president, Sister Valerie Bird, to close us out.
Good evening, everyone. I want to say this has been an awesome presentation. I know that I've learned a lot of things that I wasn't aware of, especially knowing those in our family that have dealt with these concerns and friends as well. Ladies, do please take this information back and share with your community, share with your loved ones. Dr. Aldrich, I just want to say we're definitely going to call on you again. You did an awesome job, and we do appreciate you sharing with our community this evening and your time and all that you do for our community as well and keeping us healthy. And we just want to thank you. And I know that the members will be presenting you with a token of appreciation from us in the days to come. And we do appreciate all of you all that participate in tonight's event, the engagement. Everyone, please give them a hand. I know we have some characters and kudos that we can deliver, but most importantly, please do continue to help us support our community. And thank you so much for this evening, everyone.
Good night.
Thank you.
Thank you. Have a good
Thank
night.
you. Good night.
Wonderful. Wonderful, wonderful.
Thank you.
Good job, new members.
Thank
Great job.
you.
Great job, ladies.
We're going to borrow some of those ideas. I'm just saying.
Right.
Tamika, the checklist.